Welcome to Fertilish, the podcast where we get real about fertility, infertility, and everything in between. I'm Laura.
And I'm Brandis. And whether you're knee-deep in treatments, just starting to ask questions, or somewhere in the ish of it all, you're in the right place.
Here we ditch the stigma, break down the science, and have candid conversations about the messy, emotional, and sometimes hilarious journey to growing a family and preserving your fertility.
So grab your coffee, your meds, or just your curiosity, and let's get into it.
Welcome back to Fertilish Podcast. Welcome back for episode number 2, Brandis.
Yeah, we're excited to get this going. And actually today we're going to talk about when you should see a fertility specialist and what to expect.
Oh, I'm super excited. I think that there is not enough discussion about like when to see a fertility specialist. And so many people wait until they're just like panicking to see a fertility specialist. And I think that there's a lot of education here and support that we can give people well before they've been trying for however many years.
Yeah, and, I think everyone goes by the standard guidelines of, if you're under 35, you have to try for 12 months. If you're 35 or older, you have to be trying for 6 months. And then if you're 40, to be starting to go right away. But I don't think people realize you actually don't have to wait that long.
Right. Yeah, absolutely. Anyone can see a fertility specialist at any point in time, whether you're curious about, preserving your fertility, or you just want to have like a baseline. You're wanting to try without, medications or any other interventions. You're just wanting to get a baseline of like, where do I stand at this moment?
Mm-hmm. And I think another thing too, and I get this on Instagram a lot, is people will say, I have irregular periods, or I have super painful periods, and I see, I don't see an OB, or I see an OB and I'm just not getting the answers I need. And so you can come see us even for those things. About, hey, let's get this evaluated and maybe come up with a game plan of, will I need fertility treatments in the future? Should I freeze my egg? Should we be freezing sperm? I don't think a lot of people realize you don't have to be trying to conceive and you don't have to have a partner to see us.
Absolutely. And, or even a problem, right?
Mm-hmm.
So like, you don't even have to have a problem. You can just be actively wanting to participate in knowing where you stand, hormonally and physiologically with, imaging tests, et cetera. So, obviously, we don't know a lot of times until we do the test if there is any issue. And if there's no issue, even better.
Yeah. Yeah. And I think, fertility is such a big part of women's health, obviously. And I feel like growing up, we're taught, you need pap smears, you need breast exams, but no one ever tells you, hey, you should check your ovarian reserve.
Absolutely.
And right now, it's not really in the guidelines to say, hey, you need your AMH checked once a year. But, because it doesn't really predict your natural fertility, but I think it's so important to know that because it does give you a little bit of an insight into your window of fertility maybe, and you may decide to freeze eggs or start your family sooner if you had that information. So I wish it was almost a thing to where people would see us once a year after the age of 18, 21.
No, absolutely agree. I don't believe that I ever had my AMH checked until I was maybe 37 years old and actively pursuing fertility treatment after recurrent pregnancy loss. And, knowing that we're looking at, going the IVF route. I didn't even know what an AMH was. I know I learned about it once upon a time in nursing school, but like that had been so many years ago and like completely forgotten about it. I had to, be educated again and like, what does this mean? And how does that affect me? Like, what does that mean for me?
Yeah, I know. You glaze over this stuff in sex ed and school, and no one really explains it to you. I know so many people that have come in, and they say, "Oh, well, my ovarian reserve should be fine because I've been on birth control since I was 15 and I don't ovulate, so all those eggs are still there." Like, That's like such a heartbreaking conversation to have
Yeah.
of that's actually not the case. And IVF, doesn't always work, especially if, you have a lower ovarian reserve or you're at an older age. And I don't think people realize that. I feel like if they did, they would come see us sooner, even if they weren't trying to conceive.
Well, and that it's not related to a family member. So, I mean, I hear patients tell me all the time, like, well, my mother had my sibling at 40 years old. Like, I should be just fine.
Yeah.
Or my sister has had 7 children and she's had no issues with conceiving whatsoever. Unfortunately, one doesn't equate to the other. So,
Yeah.
So assuming that because, family members have had, our blood relatives have had no issues conceiving, that you would have no issues conceiving or that your hormone levels would be great. I think that's a very big and common misconception.
Oh, yeah. And I think, it's important for people to know that just because you schedule a consult doesn't mean you have to proceed with any treatment or even do testing.
Absolutely.
I think it's a good way to open the conversation. And, I think our consults are not that expensive. I can't speak obviously for other places, but it's a pretty non-committal cost to just get your feet in the door, get established as a patient. Again, not even having to do anything, but to just have a conversation with a fertility specialist to talk about, where are you at? What are your goals? What are you wanting? But I think it is so scary to set up a consult with, an OB you hear about all the time, but to go to a fertility specialist, I think it's overwhelming for some people or a little bit scary.
Sure. No, absolutely. I think that, and just naturally, I think visiting any type of specialist in the medical field, sometimes that can be a little daunting, but it's just a conversation, right? So like we're just reviewing data, our providers are going over data, going over your goals with you, going over medical history and fertility history, and then just having a conversation with you.
Yeah. I think the cool part too is even if you are trying to conceive or even if you're not, I think OBGYNs offer this too, is a preconception visit. So if you're thinking about trying to conceive and you do the testing, for me, and we obviously do that here too, it's so much easier to prevent a problem than try and fix it. So
Absolutely.
One of the cool tests I really like is the expanded genetic carrier screening, where it's just a blood test where we check you for 500-ish different diseases of single gene disorders. So if we find out you and your partner are carriers of the same thing, patients can be educated on, hey, there's a 1 in 4 chance of you having a child with this. And we can actually do testing, PGTM testing, to prevent that with IVF. And I think if people knew that, right, because we would rather avoid having any issues than having to fix it later. And I don't think enough people know about these options.
No, I agree. When we started going down the route of, okay, we've experienced our first pregnancy loss, and, started talking to my OB about that. That was one of the first things that she suggested, was like, hey, if you're going to do some letrozole cycles, you may want to consider doing this. And she knew that we were kind of gearing up towards the route of looking at what's causing these issues. And so she was like, just, this is super easy. It was actually a buccal swab, so just a cheek swab.
Oh, it is. Okay.
And then I was able to do that, got my results a few weeks later. I wasn't a carrier of anything, so it wasn't, necessary for my husband to have his done. And so at least we had that piece of the puzzle to be able to, bring to the table and say like, hey, like this is just, as we're painting this picture of where to go next and what to do next, this is making the picture come in a little bit more clear, just having this additional information.
Yeah, and I think testing is probably another barrier because people don't. One, what testing is it?
Right.
People I don't even know if that information really is out there.
We have it on our website. So if we have a preconception testing page on our website.
page.
Yep. And it has a separate spot for female testing and then male testing.
So I've seen that. I know
Okay.
a lot of people will say, though, like, what is this test? Is it painful? And so,
Right.
like, the HSG for
Oh, it's not my
a
favorite at all.
reason.
No. Yeah.
So people, they come in and they've Googled, and I am also this person as a patient, as a provider, I'm like, don't do that. But then as a real person, I'm like crying at midnight, spiraling. But, they go down these like Reddit holes and all these things, and they've like talked themselves out of testing before even walking through the door or scheduling an appointment. And I think, testing wise and what it is, it's a lot of blood work where we check hormones and thyroid and ovarian reserve. We do that expanded carrier screening, depending on if you've had miscarriages, sometimes a recurrent pregnancy loss panel, and then imaging. So usually it's a saline sonogram where we put saline into the uterus and then we kind of expand it. So it sits like this, expand it, we look with ultrasound to make sure that there's nothing in the uterine cavity. And then that hysterosalpingogram or HSG test where we put dye through the uterus and take pictures with basically an x-ray machine to make sure one or both tubes are open. And I've never personally gone through any imaging, just the testing, but I know you have gone through all of it, right?
Yes, and HSG is probably my least favorite part of this journey, aside from the emotional portion of it. I mean, I think it's like important to be transparent about it. It's not my favorite thing in the world to do at all. But one thing that I also tell patients is, like, for example, if we have a patient that's like, I know you recommend testing, to repeat this every year. Well, it's been about a year and a half. Like, do I have to have this done again? And I just say, like, hey, like, I'm going to take my CNY hat off for a second and, like, just talk to you as a fellow patient. If there was something that I could do on the front end and it was as simple as, yes, this test sucks. Like, it's definitely not something I just, like, think that I want to do on a random Wednesday. But if I could get that test done and like at least have this knowledge as I went into another cycle of IVF or as I went into my first cycle of IVF, whatever the case may be, and I would much rather do that than look back on a cycle and wonder what information might I have gotten from repeating that test that I didn't have over the last year and a half since I had that test done. And now I'm doubting myself and wondering, like, well, was there something that I could have done? And so I think that there is already enough, like, self-doubt, guilt, worry in all of this journey, whether you're preserving your fertility, you're seeking fertility treatment to build your family. I think it's already difficult enough. And so I would much rather be uncomfortable for a couple of minutes because it is a super short test. Like, I'd much rather be uncomfortable for a couple of minutes than to have, like, now I'm putting all of this extra stress on myself, just like wondering, like, was there something I could have done to prevent it?
Yeah, 100%. And so many times, you say it, patients ask, do I have to do this test again? I had it years ago. And it's like, you don't have to do anything.
Right.
Anything you don't want to do, you never have to do. But, yeah, you're putting so much money and time and emotional toll into this that it's worth it to do all the recommended testing just to make sure, that everything is checked before we're doing any treatment. So I think that's important. And I think it's important as a patient that you say that too.
Well, the more data, the better. The more data that we can provide as patients to our providers so that they have a clear picture of how to guide us, the better they're able to do so. And so I think that, like, I mean, obviously patient autonomy is extremely important at CNY. Like, that's one of the things that we pride ourselves on. And I think that it's really important. It's something that is one of my core beliefs is patients having autonomy, especially in a journey like this. And so, yes, I think it's very important that you note that, like, you never have to do anything that you don't want to do. and you're never going to want to do an HSG, but you could decide to do an HSG. If you decide to do an HSG, I think that it is important to know, like, just having that additional information, because a lot can change in a year or a year and a half, or sometimes even less than that.
Yeah. Yeah. And I think as far as, what even to expect for like a first consult, did you have a consult? You've had a consult here, obviously.
Yeah,
what
with
was
Dr.
that?
Kiltz, actually.
Okay.
Yep.
So what, and I mean, I'll say how I run consults. I can't speak for every provider here because we're all so different. We all, are very knowledgeable about every aspect of fertility. But I think all of our methods are a little bit different. So I guess what was
Sure.
your experience for a first consult like?
Yeah, so, Dr. Kiltz, so when I came to CNY, I had been through a cycle of IVF previously, and CNY was actually my third fertility clinic. And this was obviously before I worked for CNY. And so we had been through a cycle of IVF that cost us about $30,000, and hadn't achieved success with that. And although I loved that clinic, like, everybody was absolutely amazing, I still, like, keep in touch with them to this day. Like, they're amazing. I love them. It just wasn't feasible for us, as far as, like, from a cost standpoint. And we had also moved across the country at that point too. And so it just wasn't something that was in our wheelhouse to try to do that again. And then, my second fertility clinic, I didn't love them, and I was like, this is not for me.
Yeah.
And so I was like, all right, well, I had heard about CNY. I had known other people that had gone through, to CNY and had success. And a good fertility friend of mine, whom I've still never met in person to this day, has been such an amazing support system for me. She was like, Laura, like, why don't you go to CNY? Like, why, because I was researching all of the places you could get a second job and get, fertility coverage. And so, I came to CNY just for a consult, honestly. Like, there was no plan of, like, if we were going to move forward with, if we were even going to do another cycle of IVF. Like, we hadn't even gotten to that place of committal of 100%. And so I literally came just for a consult. So obviously I had uploaded all of my records to the patient portal. We had filled out the medical history in both of our patient portals, and repeated some testing. And so, I met with Dr. Kiltz via telehealth. And so he had already reviewed, my previous records. And we, went over what I was hoping to achieve. I do always recommend, when you go to a consult, especially a telehealth consult, just as a patient, I always recommend to, like, come with, like, all your points and questions that you want to make, because it's so easy in that call to forget. And then you get off the call and you're like, oh crap, like, I really wanted to ask this, or I wanted to ask that. And it's not that you can't reach back out, because you can, but then you're, it's just, I just feel like that it's just better to, like, have it written down, so that way, as when you're involved in the call, you can be like, oh, yep, one more thing. I have one more question, or, one more thing I want to let you know. So I had my piece of paper, and we were going over everything. And so, Dr. Kiltz was talking faster than I could write. I was trying to make notes, and he was like, it's fine, I'm going to send you all the notes.
Yeah.
I was like, okay, thank you.
Yeah.
But yeah, we went over all of that information, and he told me, hey, like, this is what we didn't work for you. This is what I would have you do, like, as we start to try to do something different. Because if we know what's not working, then why would we repeat that? Like, if that's not working, and it's going to be something different for each patient. And so, I felt so good about that call, and so confident in, like, having a new plan of action to move forward. And that, talked to my husband, and we decided to move forward. But yeah, I think that it's really important, because it's easy to get wrapped up in the call of all the information. It just, like, that would be one of my main suggestions, would be to come with information that you want to tell and ask. And then obviously if it goes too fast and there's too much information, we can always send you the notes on the call.
Yeah, I think that's actually a really good tip because I have so many patients that are always like, I had all these questions and now I forgot.
Right.
And it's like, okay, well, if you think of them, just send a message. But it's always nice when you have one of us on the phone. And the way, I guess, I specifically run my consults, I guess it just depends on what you're coming here for. So, if you've been a patient somewhere else before or you've done cycles elsewhere, usually those are uploaded by the first consult.
Right.
And so, I'll review all of those. In my head, I've already formulated a plan of how things are going to go differently. But sometimes, even though I have all of that, I'm going through an intake form. So I'm asking you questions. And a lot of people I already filled that out. And it's like, I know, I just want to make sure it's all right and on this form and confirm things. And, if you've had cycles in the past, were they IVF cycles? What doses were you on? Did you make embryos? What kind of embryos? Were they day 3s or blasts? Mm-hmm. Did you do testing? Did you do transfers? Did those transfers take, or were they, unsuccessful? Were they biochemicals? And so many times I'll ask these questions and patients are like, oh, this is like a lot. And it is, but it's like so important to know each detail to kind of decide, okay, what is happening? Why is it working? Why is it not working? And to kind of move forward. So a lot of it is just reviewing records, history taking. So again, you don't need to be trying to conceive if you're just wanting to test your fertility.
Right.
I will ask about, your periods. Are they regular? Do you have painful periods? Do you have pain with intercourse? So there are so many things that we review, and then based on your history and what you tell me, I will order testing for the treatment that you need, or for egg freezing or whatever else, males to a semen analysis. And then that day, if you know what you want to do, usually I'll put in a plan so that way once testing is done, you can move forward. And I always tell them, once we get those labs back, if I need to adjust any of your meds, I can obviously do that. Mm-hmm. And then you can just move forward. Another important thing I talk about patients is about their goals. So if, they're 35 and they want one child, then I may say, if you want to try timed intercourse with letrozole or Clomid or IUI, I think that's fine. Mm-hmm. If you're 35 and you want 4 kids,
that's a different conversation.
Yeah, then maybe we need to do IVF and bank embryos so that way we're not worried about a biological clock later. And so I think it's so important at your first consult to really think about what your goals are.
Agree.
And I think a lot of people go to fertility specialists with the goal of, I want to be pregnant right now.
Right.
And they don't
or even yesterday.
Yes. And they don't think about like what they want their family to look like. Because so many times I tell people, if you could design your family, what would it look like?
Yeah.
And they say, well, at this point, I'd be happy with one. And it's like, take that off the table.
Right, because I know that's like a realistic answer for so many people, especially whenever you've been trying for so long or you've had recurrent pregnancy loss or, but yes, like, do you have aspirations? Like, if you were to get that one child, is that longing desire, for an additional child, is that going to still be there, or you literally just want the one child? Because there's options for you and they may look a little different based on those answers.
Mm-hmm. Yeah. And I think I always am like, no, don't tell me. Like, tell me what you would actually want, because my job is not to get you, the bare minimum. If I can get you to your goal, right, I'm going to do what I can to get you there. So make sure you're voicing that. And I think another thing is, and I don't know where you sit on this spectrum, but we have a lot of patients too that for religious reasons, they don't want to freeze multiple embryos. And so they think IVF is off the table for them, when really there's workarounds. We can freeze eggs and then fertilize them later. And so I think if that's an important thing to you, I think instead of not making a consult, I think it's important just to voice those things. Obviously, we talk about patient autonomy a lot. There's zero judgment on any of that. And we'll support kind of whatever religion decision you decide to make.
No, absolutely. And we have patients from like so many different backgrounds, so many different belief systems, so many different, wants, needs, desires. I talk to patients, lots of patients who are like, give me all the embryos. And then lots of patients who are like, I don't want to use meds, in an IVF cycle. And that is absolutely your right to say, like, hey, that's not something that I'm interested in. I want to do this particular way. And that goes back to exactly what you were saying about patient autonomy. And so those types of things, yes, I 100% agree. Those are types of things that you would definitely want to mention and have conversations about during your consultation, because as the provider is developing a protocol to move forward for you, those are the things that they definitely need to know so that they can most appropriately design a plan of action for your specific circumstances.
Yeah, and I feel like when you even mention the meds, some people are like, I don't even take Tylenol.
Right.
And so it's like, well, this is a little bit different. So like I make it a point to always educate patients, and then after you're educated, the decision's yours.
Right.
Whatever you decide, and I have a lot of, for some reason recently, a lot of patients will bring up, I only want to do this many embryos, or, I only want to freeze eggs and fertilize later because of this religion, or because, different reasons. And then I always get the follow-up of, well, what do you believe? And I'm always like, oh, no, I'm pro however you want to build your family. So that's the important thing to know when you get a provider, too, is that our personal anything stays out of it. So our job is to kind of help you to make a family based on how you want to do it. So
right, you're there to guide, but ultimately it's the patient's decision. Yeah, absolutely. Yeah. And I think that's I actually, we get asked that at CNY a lot because they have been denied for the exact thing that they're wanting, maybe by another clinic previously. And they've been denied for doing a natural IVF cycle, or, the clinic is not interested in trying to do it without medication, or, obviously there's plenty of clinics that do natural IVF cycles, and we're certainly one of them. But you're exactly right. I think it's important not to allow the provider's beliefs or, views on one thing or the other. They can give you their best professional advice, but ultimately it's your decision.
Yeah. Yeah. And that's another thing too you brought up, that we don't really exclude anyone. So any age, we take any BMI, we take any AMH level. So we don't exclude people from, who gets to try. Dr. Kilt is a big believer in everybody deserves to try to have a family in whatever way they want. And so that's a big thing here that I think is pretty cool, that we let everyone try and we don't exclude anyone.
Yeah, I had a patient that reached out to me yesterday, or a potential patient, someone who's interested in CNY, and she said, I've read that the cutoff is 39 for IVF, and I wanted to see if that was the case for your clinic. And so I was like, no, like we don't have any age restrictions. And she was like, no, but like I want to know the real cutoff, like what's the real age limit, because I don't want to pay for a consultation if I'm too old. And she was like, and I was like, no, you're not. Like there's literally no age restrictions. And she like just didn't believe me. And I was like, no, that's the truth. Like we don't have any age restrictions. And so I went into, further telling her, like, we don't have a BMI restriction. We don't have, hormone restrictions. So I think that's really amazing that, just because you have what's considered to be a super low AMH does not mean that you can't achieve a healthy live birth. And so just because whatever the reason, just because you're 42 or you're 45 does not mean that you can't achieve a healthy live birth. Does it mean that you may need some help along the way? And that's what we're here to do. But it doesn't mean that you can't bring home a healthy baby.
Yeah. And I think, we get a lot of that too about, oh, well, I didn't qualify at my other clinic, or, we get patients for all kinds of reasons, whether it be travel restrictions or, cost obviously is a big one. But, I think something important to understand too is like when and it depends when you say older what you mean, but older people that, their cycles have stopped and they say, okay, well, I want to try an IVF cycle. Ethically for me, it's like, okay, I'm going to tell you that your menstrual cycles have stopped because of this reason.
Right.
And so we have that like candid conversation, and sometimes, you educate somebody, but education can go so far, and sometimes there's an emotional part of it where people are like, well, I have to try it to know. And so that's okay. And I think we do have a lot of that here too, where it's
Right.
like, before I'm ready to, maybe try donor egg or donor embryo or even just adopt or a GC, I need to try for myself.
Absolutely.
And so that's, I think, another cool thing that, we're not going to tell you no.
Absolutely. And that's what I explain to. So, day to day I meet with OBGYNs, providers, sometimes all over the U.S. And so when I am telling them how we can help their patients, you may have a patient that may be 39 or 40 who's been to another clinic, and that clinic has said, hey, like, and it's strictly based on like their AMH or their age or some, singular indicator supposedly of success. And so they've directed them like, hey, we would recommend that you go straight to donor eggs. Well, this 39-year-old and this 39-year-old are probably not going to look anything like, and so I always tell providers, like, we're going to coach patients on what success looks like for them. But at the end of the day, even if we say, hey, we would recommend probably trying donor eggs. We have some patients that say, like, don't even say that word to me, put it in my chart. Like, I don't even hear that word. I'm not there yet. And some patients who we don't even feel like that donor eggs is the route that they should go, are already ready. Like, hey, if I need donor eggs, so the journey looks different for everyone. But at the end of the day, like, even if we do recommend, hey, we think that the next step probably would be donor eggs, but they want to try a cycle or two of their own eggs, that's their choice. And I think that, that's really amazing because, a lot of clinics don't offer that, and that goes back to that patient autonomy that we're able to offer, and that we all believe in, at CNY so much.
Yeah, and I think that's cool and goes back to, you don't have to be trying to come see us because, some people, donor egg is not something they want to talk about, and so, if you're in that group, ovarian reserve testing, maybe you just want your fertility tested. So, you're going to come in, or someone has had an STD in the past, and they want to, check and see if their tubes are open. And so, a lot of ways or reasons you can come to see us. We do a lot of fertility preservation as well. Yeah. So sperm and egg freezing, especially before chemo. If you have a single gene disorder that runs in your family. So cool part is, we kind of talked about it before, but the BRCA gene, muscular dystrophy, cystic fibrosis, those sort of things we can test for. So if something runs in your family, we can kind of help so that your child isn't affected by it. Irregular periods, just questions. And I don't think it's talked about enough. I wish it was like a yearly visit after the age of 18 or 21. But yeah, there's all sorts of reasons you could come to see us. It doesn't mean you have to move forward with treatment. And the testing isn't as scary as Google
no, not at all.
makes it out to seem. And I think that's so important that people know that.
Yeah, no, not at all. And I mean, the majority of it is going to be blood work, and just a, single venipuncture and take some vials of blood, and, you'll get some results back, depending on how they were ordered, but, in a relatively short amount of time. And so, and then those 2 imaging tests and, the SHG, I had like worked myself because of the HSG. I had worked myself up into a frenzy about getting that. And then I was like, oh, that was it? Like, you're done? What? That didn't hurt at all. So yeah, I think that, sometimes we're our worst enemies.
Oh, yeah. Yeah. And then I think the only things that we haven't touched on as far as things we do, there's probably more, but obviously we do gestational carriers, and gestational carriers are more common now, meaning you have your own embryo that we put into a carrier, basically. And then gender selection or family balancing is another reason that we see a lot of patients. And then you don't have to have a partner to do this.
That's right.
So I've had, single dads by choice, single moms by choice, where they either use a known donor for sperm or an anonymous donor from a bank. And so that's the reason, people do IVF too, is you could do it yourself. So you don't need, we have a lot of people that are older and they're ready for a family and they just don't have a partner and decide to do it on their own. And that's
Absolutely.
something we do too.
Yeah, absolutely. And some of the like larger sperm banks even give our patients a discount. And so we definitely appreciate their partnership on being able to, search donor profiles and find the fit that works best for them. And then obviously we have our own in-house egg donor bank that patients can utilize if they need or want those services. And so I think that's really amazing. So many people are so surprised that we have our own in-house egg donor bank. And I think that's really amazing that we're able to help so many patients at that still cost-effective, price point.
Oh, yeah. And, donor sperm can be used for many reasons, donor egg, but we also have obviously same-sex couples, so those doing reciprocal IVF, basic IVF, which is probably a topic for another episode because that's a whole other thing to get into. But
Sure.
Yeah, so we do all sorts of things. Hopefully this was helpful in, cluing people into you don't have to be trying to get pregnant to see us.
That's right. That's right. Absolutely. There's a whole host of reasons why you may want to come and see us. And if you don't need to come back past the consult and everything's great, that's even better. So.
Yeah, and it's not that scary. You already know us a little, so.
Yeah, that's right.
All right. Well, I think that's pretty much all I've had to hit on for, I guess, when to see us. I don't know if you have anything else you want to add.
I just, obviously recommend tuning in each Tuesday for a new episode. So we'll be dropping episodes every Tuesday. Give us a like and subscribe to our podcast. And then definitely check out cnyfertility.com/fertilish for additional information on the podcast. You can even communicate with us, so call to actions. If you have questions, suggestions, anything that you may want to see on the show, we would love to hear from you. And follow us on Instagram, obviously our CNY Fertility page, TikTok, Facebook, all the platforms. Subscribe on YouTube. You can watch us while we're talking. You don't have to just listen. You can see us too. Can't wait to see you back next Tuesday.